Okay, thank you, Giovanna. So the target audience of my infographic is definitely the OT or the OTA, especially considering how dating is an aspect of sociality, which is not often addressed in OT practice. Dating can be an incredibly fulfilling part of any person's life, and this is no different for an individual with Down syndrome. So that is why it is extremely relevant to OT and why it's something that should be addressed if the patient expresses interest in it. So I've included some common struggles of people with Down syndrome, specifically those which are relevant for establishing and maintaining intimate relationships. So social cues, communication, interpreting emotions, and self-care. And then just some clinical implications of our topic. I think these are really important things to emphasize within practice as an OT. So the self-esteem, social interaction skills, self-assertion, and sexual health of the patient. Next, for the importance of context, one of the things that I really wanted to emphasize in this infographic is that dating looks different for different people. So safe sex education will look different for a homosexual patient versus a heterosexual one. So it really is important to tailor therapeutic intervention to the individual and their life because the adequacy of their education really depends on it. Next, so I think the most important part of this infographic is addressing different ways that occupational therapy can really be pivotal in giving OTs ideas for their own patients. So first, a common way to help is by practicing dating. So basically just walking the patient through the experience of dating to identify their individual struggles and to work towards honing those specific skills. Next, establishing boundaries. So the topic of consent is really important, especially in this situation where the patient does have intellectual delays and cognitive differences. So making sure that the patient is able to process and express their personal boundaries to prevent exploitation or abuse. Next, self-care. So as we all know, taking care of your body and your personal hygiene is definitely implicated in intimate relationships. So just reminding OTs again of the importance of this and the role that self-care plays in social participation. Safe sex education. So there is a lot of stigma and biases associated with intellectually disabled individuals engaging in sex. It's a big misunderstanding that people with Down syndrome are infertile, and that is not always the case. So educating them of this and making sure they are using contraceptives appropriately is crucial. And for consent, this is not only important for the individual, but for their potential partners as well, and making sure that they are educated about sexually transmitted infections. Lastly, something that I think needs to be discussed is the role of caregivers. Many people with Down syndrome require lifelong support from their caregivers, and this does not leave much room for privacy for intimate relationships. Parents can be unprepared or unwilling to discuss safe sex with their children, which is a big issue. So it really is the job of the OT not only to make sure that the patient is educated, but to help the caregiver help the patient. This brings up the conversation of the biases that we all have about people with disabilities holding these types of intimate relationships. So I think it is definitely an important matter to bring up. Thank you so much, and I hope you all enjoyed our presentation.